And I see that people are popping in, but let's get going for this session. And this is a panel club, so it's a bit different from the ones where you sit back and listen to presentations and follow a PowerPoint. We will have none of those. Instead, we hope this to be an interactive session where we get you engaged in conversations with us. My name is Ulrika von Thiele-Schwartz. I'm a professor of psychology at Mälardalen University, Västerås, Sweden, and also at Karolinska Institutet, Stockholm, Sweden. I will be the chair of this session. I also have a panel with me. A bit fewer in the panel that we anticipated. We still hope for the third member of the panel to join us. He is in Seattle. We hope that he's just getting, he wakes up and joins the session. But unfortunately, he's not here at the time. My research is about design, implementation, and evaluation of different types of initiatives in organizations. So it's implementation from a working life perspective, if you may. And I must say, I get equally frustrated with the fact that we as researchers keep developing interventions and evidence that are not used in practice, with the fact that the research community somehow also managed to fail to provide practice communities with the information and knowledge that they feel that they need in order to, for their end users to benefit. And there seems to be this glitch here. And for me and for the panel members, we believe that the question about fidelity and adaptation is at the core of this question. So fidelity and adaptation will be the focus of this panel club. So as I mentioned, this is not your ordinary session. We hope that will be interactive. And I'll just give you a brief idea of what this hour will look like. So often we will start with a short poll to get a sense of who's in the room, 24 people that are here right now. I will then ask the panel to introduce themselves, and they will also introduce a statement that we would like you to think about and actually decide what you would like to discuss further. We will have we will use breakout rooms just to make it a bit easier to discuss and give room for more voices to be heard, and then reconvene in the whole group to see what's been up and what we've learned and thought so far, and listening on with the panel again on their impressions. So, but before I leave the floor to the panel, I would like to ask you to respond to a poll, 4 poll questions. So if I can ask Cassandra to open it up, and you should have it on your screen. So please respond to the poll questions. And Cassandra, I trust that you will somehow magically show us the response to the poll questions once we've given everyone the chance to respond. Okay, and here we have it. So we seem to be in mostly researchers in this room, with the implementation support staff, practitioners, as well as the always intriguing category of other. We had the next question is if it's important that EBIs are used with high fidelity. We see most of us to think that at least to somewhat agree with that statement. So let's see if it's also possible to use EBIs with high fidelity. Same there, somewhat agree that it's possible. Whereas we have seemed all to agree that adaptations increase utility, either somewhat or completely agree. So let's see if we can get all this together, that we both think that it's possible and important to use EBIs with high fidelity, and that adaptations of EBIs increase utility. Seems to be a bit of a dilemma in that. So thank you. With that, I would like to ask our first panel member to introduce herself. That's Henna Hasson.
Okay, thank you, Ulrika. So my name is Henna Hasson, and I'm a professor in implementation science at Karolinska Institutet in Sweden. So I have a role as a researcher, but I also have a role as a supporting implementation in health and social service organizations by working in a regional health provider organization in region Stockholm. So 2 roles that I might be talking about today. Ulrika, do you want me to present the question already, or do we take Knut maybe first? Or?
Maybe go to Knut first, and I'll return to the statement.
All right, Knut Sundell, that's me. And I'm an associate professor in psychology. And when I look back on my research career, I see that I've done it all, or at least most of it. I've been developing interventions. I've been evaluating different interventions. I've been implementing interventions. I've been a policymaker at the National Board of Health and Welfare in Sweden, trying to promote evidence-based practice. And now I'm working at the Swedish Agency for Health Technology Assessment and Assessment of Social Services. That's some kind of combined Cochrane and Campbell. So what I'm doing is synthesizing research and trying to disseminate it as well.
Well, aren't we in luck that we have 2 persons in the panel who both kind of fulfill a lot of the different roles that we intended different panel members to occupy? Because if I'm not missing something in the list of participants, unfortunately, we do not have Aaron here just yet. Aaron Line, who is associate professor at the University of Washington, which means he's on the west coast of the US, really early morning. So who knows? Maybe he will actually join us. But and we were also supposed to have Kata Nylén with us, who is a psychologist and who is kind of on the receiving end in the research to practice pathway when it comes to having a role of trying to use evidence and interventions that others have developed and evaluated. The good thing is that they have provided us with some input for our discussions. So what we did in preparation for this session was to ask our panel members to come up with a statement which they think might possibly provoke you, but also to help start thinking and about adaptation and fidelity. And we are suggesting what we're going to do is to use these statements in second poll, where you will be able to vote on what theme you would like to discuss further. Then, of course, if you find them all intriguing or you want to discuss something else, we will not prevent you from doing that. But we hope that giving a bit of food for thought will make it easier to get started in the discussions. So, Henna, what do you suggest?
You want to hear my statement?
Yes, I want to hear your statement.
Quite provocative might be. Let's see. So my statement was adaptations to evidence-based interventions are most often done based on professionals' preferences and not based on clients or patient situation. So the issue I wanted to raise with this this statement was the reasons for adapting any kind of evidence-based intervention. So why is not high fidelity maintained? So bit of maybe a bit more clarifications for the statement, so that for the discussion would be that there might be multiple reasons for adaptations. Of course, there can be contextual factors affecting. It might be lack of time or lack of materials or other resources, or like organizational issues, or maybe regulations. All that is about the context. There might also be client and patient preferences, maybe goals with intervention, prior experiences, and so on, impacting their health status and their goals with that, with taking part of in an intervention. But then there is also the professionals, which I think sometimes we're not talking so much about. It's all about, for professionals, for instance, competence or skills. So are they able to do what's required in an evidence-based intervention? But it's also about values and preferences of the professionals. This might also impact whether they feel comfortable to perform an evidence-based intervention as it's described in any kind of a manual or description. And this might be the issue that we haven't really touched upon so much in discussion and research. So my statement was adaptation to evidence-based interventions are most often done based on professionals' preferences and not clients' patient situation.
Thank you. Knut?
Yeah.
What do you have to offer?
I'd like to say, don't tinker with perfection unless you have a researcher or do research. That is, don't change the content of the intervention because you don't know what you will get. And there are ample examples where people tinker with perfection and you get something which is completely different, and where those who should know say that it's just wasted money. Take just one example. In Sweden, some 10-15 years ago, we had something which we called aggression replacement training that was very popular among social services. That's an intervention targeting behavior problems, youth behavior problems. And it consists of 3 pieces that should be used. There are 3 modules, one which is social skill training, one is anger management, and one is moral reasoning. And you should have at least 10 lessons. You should have 10 lessons of each of these 3, so 30, but the program constructor said, okay, 20 is okay, that's fine, that's enough. And then you should have role play and reinforcement for positive behaviors, etc., etc. When we looked at this 2006, it was 20% that used the intervention in a way that was considered effective according to those that developed the program. And 6 years later, 2012, it was only 10%. So 90% of the resources used were probably just waste.
Thanks. So there you have the second statement. So if you can Cassandra, if you can put up the second poll question, I will also present you the other two options, which was offered by Kata Nylén, the psychologist who's on the receiving end of the interventions that we developed. Her statement was, utility should have a higher priority than fidelity. And the way that she explained that is that it doesn't really matter if you have high fidelity if it isn't used in practice. And so it wouldn't matter how efficient an intervention is if it can't be used. Therefore, utility should take priority. And Aaron's suggested statement is, traditional notions of fidelity are outdated and largely irrelevant to modern implementation science. I think that might speak for itself. So what I would like you to do is to vote. Which one would you prefer to spend the next 10 minutes on? Noting that, again, if you then end up talking about something different in the breakout rooms, we will we will be happy with that too. Cassandra, as soon as you have the votes in, let us know what our winner is and throw us out into the breakout rooms. Oh, that was a close call. So it seems that traditional notions of fidelity are outdated and largely irrelevant to modern implementation science, was the #1 choice, followed by adaptations that are most often based on professional preferences. So let's keep these in mind as our food for thought. And Cassandra will help us to get into 3 different breakout rooms, and Henna, Knut, and myself will also be in those to hear what you say about these issues. So hope to see you in the breakout rooms.
No, Aaron?
I'm here, surprise.
Hey, surprise.
Sorry about that.
Good to see you, everyone. And this worked out really well. So Aaron is now joining us, and I'll give him a chance to introduce himself. And the fun thing is that it was actually your statement that we've been discussing. So this is a really good reason for us to go through what was raised in the group. So I'll first give you a chance to introduce yourself, Aaron.
Great, thanks so much. I'm Aaron Lyon. I'm an associate professor at the University of Washington in Seattle, Washington in the States. And one of the main things I spend time on is as director of the methods core of the University of Washington Alacrity Center, which is focused on the intersection of implementation science and human-centered design in order to redesign psychosocial interventions. And apologies for being late. I double and triple checked the time zone conversion and I was still unsuccessful. Sometimes that's just how it goes.
We're glad you can join us. So I'm really curious about what happened in the other breakout rooms, and I'm sure you're interested in hear what happened in mine. So I don't know if anyone in the audience want to comment. You're welcome to. Otherwise, I would invite Henna or Knut to say what happened.
I'm happy if someone from our group would like to tell what happened. If not, I can do it. And you can add if there is anything I will miss. We talked a lot. We started from the question, so what is a traditional view of fidelity? Well, what is that? We missed you, Aaron, to tell us what it was, but we did our own view. We presented our own view, and then we, of course, talked about a lot about evidence in a broader sense.
What did you decide it was? Because we talked about it too.
You also talked about it. We never really ended up in deciding anything. We just talked about different views on, but quite much about, so maybe traditional view on fidelity would be that fidelity is the only good thing, and any variations from fidelity would be bad, to put it very short and simple. But we also talked about, so fidelity to what? Fidelity to a certain behaviors, or fidelity to a theory, or intentions, or what level is the fidelity? Do you want to add something?
Did you agree with Aaron's statement, or did you oppose it?
What do you think, the people in our group? What were your thoughts? We didn't really we got carried away in an interesting discussion, I would say, rather than really.
I don't think we ended up with any conclusion, but we also discussed what is the evidence-based part of interventions. We also were critical about that and in relation to fidelity. So that's also something we discussed.
Good, thank you, Annika.
Yeah. So, and in our groups, we started off with that first question as well, and talking about fidelity as one of the kind of key metrics, if you'd like, in implementation research, when we want to determine if something worked or not. And we also spent we did have a participant that started off saying, so why would anyone not think it's important or a primary concern? So that sparked a lot of discussions, and we also spent some time talking about which I know you know is dear to my heart, Hannah, what we can do upstream to ensure that whatever we as researchers are involved in designing and evaluating has and stand any chance of being used. And so it was, for example, it was suggested that we might want to change the way we design the studies, or for example, by using a hybrid type of designs, and to give ourselves a better chance of not only focusing on effectiveness or and so, but also on the usefulness of intervention as part of the evaluation. I guess that might be something that you want to pick up on, Aaron.
Yeah, I mean, I feel like this is something I grapple with a lot. Obviously, I don't know exactly what was discussed in the breakout rooms, or even in the introduction before we went into them. I mean, I feel like the findings related to fidelity and its link to actual kind of service recipient outcomes are probably mixed at best. And I feel like that's why so many of us have begun re-examining sort of how we approach fidelity and what we're really doing as we attend to fidelity, which I totally agree with Ulrika is a kind of a core implementation outcome. I feel like fidelity tends to map on to some of our thinking that's been very prominent in implementation science, but it's maybe becoming a little less so. And it's the core components and adaptable periphery kind of thinking, where there are core components to which one might, at least traditionally, require fidelity. And then we also see some more sort of movement away from that into things that are maybe a little bit more flexible as far as we conceptualize what's important and what might not be quite as important in some of our interventions. I've been fairly compelled by the work by people like Brian Mittman, who's been discussing a lot over the last few years, form and function, intervention form and intervention function. which is probably not a new concept for many of you. And I feel like it's a different and somewhat useful conceptualization of fidelity if we think of fidelity broadly as what's important and what's not and why. So if we can think about intervention function and the sort of the mechanisms through which, or as we often say, sort of the levers that interventions are trying to pull in order to have their effect, are there ways that we can move past sort of fidelity to particular practices as they manifest on the surface and go further into why something works and all the different ways that it could potentially work through the same mechanisms.
So Knut, given that you started to try to provoke us by saying that we shouldn't tinker with perfection. So what are your thoughts on this and the discussions that you had in your break?
Well, first of all, our discussion was, we didn't reach any consensus, of course, because it's very easy to find the counter examples. I mentioned for my group, we developed this parent management training program in which timeout is considered a very important core component, but that component doesn't fit well to the Swedish society, so we dropped it. And the program, surprise, worked fine. But the point is, we did research on it, so we learned something. So tinker with perfection, sure, but you need research to follow it to see what happens. Another issue we talked about was, of course, what is an evidence-based intervention, whatever we call it. We have interventions that are hardly describe what they do, and surely no one would be able to tell what is core components there. So in that case, I would say it doesn't matter. You could manipulate as much as you want, because perhaps someone sometime finds out, oh, this seems to work. Perhaps we should do research on it. On the other hand, if we have a well-developed intervention, a lot of research proves that it works in that fashion, I would say, okay, stay fidel. High fidelity is important, because if you start to temper with perfection, then it's also an ethical issue. Perhaps you don't do good. Perhaps those resources would be better used for those clients doing something else.
So, but what about if we instead say that we don't do anything unless instead of saying that it has to be a research or a research project, what about if we use data to find out what works and what doesn't, and kind of connect the implementation with continuous improvement of services? Would that be okay?
If you do research on it, sure.
Not only locally looking at data and improving.
Well,
I guess it depends on how you define research.
Sure. But every intervention, I would say, comes with a continuum. How sure are we that this intervention works? If you are very unsure, I have no problem with drift or whatever. If you're very sure, it's another question. How to handle it? Or do you disagree?
Do I disagree? I would say that I think that for me the question about fidelity and adaptation is, it does relate to trustworthiness of how much you can trust that you will have a certain outcome. But I would say that that's also, it does not rely only on the intervention and how well you retain fidelity to that, but also on where it's done, used, and how you're implementing it. And that is both the context, implementation, and the intervention that will determine your outcomes. And so it's kind of fidelity to all of those if you want to have the same type of results. And most of the times it's different. It's used in a different context, and it's implemented in a different way. And then you still have changed parts of the equation, and you would end up have a different outcome anyway. So I think, and I will, since we only have we have 10 minutes left. Yeah, we don't have to conclude just yet. So good, because I would say that means that regardless if you try to retain high fidelity or if you're trying to adapt, you should look at your data and see if it's kind of behaving the way you expect it to do. Because if you retain high fidelity, but the context is different and you have implemented it in different ways, for example, through another way of training or so, I wouldn't expect to see the same outcomes. And of course, if you change the intervention to increase the fit with the context, maybe you would have a different type of set of outcomes as well.
Would you consider Sweden and United States to be different countries, different contexts?
Yeah.
Well, we have ample examples of interventions that work equal well.
Yeah, because sometimes, I mean, it depends. I mean, that's the tricky thing. But when it comes to context, we probably have to define what it is in the context that matters.
And another thing is if people can't implement an intervention with fidelity, then something is problem. There's a problem somewhere. Perhaps you shouldn't have the intervention at all.
But Henna, I think that is getting us close to a statement that you offered, or you were thinking about offering earlier, right?
Oh, what was that one then?
I think we talked about. I think it was you talked about.
The reason for the one I offered. You mean the
no, not this time. When we discussed it earlier. So, do people try? Should they implement less things? Should they be more careful what you decide to implement because of the efforts involved?
Yeah, or at least make a careful consideration before deciding implement an intervention. Studying the intervention quite carefully, it might fit and it might not fit, and I think I was talking more about kind of pre-planning and kind of trying to understand, is this really the best program for our needs and the needs of our clients and in our setting? Is there a chance of this intervention being implemented with a fair amount of fidelity? Because otherwise it might be worth of just continuing the work we're already doing if we're getting good results. If we are not getting good results, then of course we need to change, but there might be other programs or we might develop our own program. So I guess that was the discussion we were having. But I think one of the main points I would like to do is that I don't think we can leave this issue of fidelity and adaptation only to professionals to decide, because it's quite heavy burden. It's a dilemma that it's difficult even for us here to discuss, but it's very difficult in the very practical healthcare situations or social service situations. If there is no guidance at all from any kind of regulatory agencies or organizations, supervisors, it's very tricky issue to deal with. So should I be able to do all these components in this intervention, or can I adapt? If I don't get any guidance from my organization, I would say it's very difficult. And then statements like fidelity is always good makes it even more troublesome from maybe an ethical perspective for a professional, or from a more moral perspective or different perspective. So that's I would say that we need a more systematic support and guidance for professionals to be able to make good decisions. And in some cases, decisions need to be made on different levels. Some issues might be decided on higher up in the organization to give a little bit boundaries for professionals.
I could add sorry.
So I wanted to invite the audience as well. So as you may have noticed, this is topics that the four of us could discuss for forever and ever. But I do want to give you a chance. Yes, Orly.
Yeah, I want to back to what you were saying, Henna, that we should put guidelines. I was wondering, where or how would you want to do that? Would you need to implement that in the manual, or when you're sort of researching the intervention for the first time, what is acceptable drift and what's not? Or would you need to study that in each new context? Or would you need to implement a sort of support system so that professionals can do that on their own with data or with supervisors or with anything? And then, so how to go about supporting professionals in doing sort of acceptable drift or acceptable adaptations in a feasible way?
Excellent question. So how to do this? Well, I guess as maybe a program developer, as a researcher, we might have knowledge that could be valuable for a professional that we could provide about the flexibility of a certain program. That is more than nothing to provide some kind of guidance for that. Maybe some support, some very tricky issues could also need a specific support intervention. That could maybe, that needs to be tested, whether that would be an efficient way of supporting professionals.
Yeah.
I don't know if Aaron or Knut have any, or Ulrika have any thoughts on this, how to do part.
I think it's one of the
Yeah, I know that everyone has, so please.
I think it's one of the things that could have a lot of different supports. I don't think there's necessarily one way, just as in when we're implementing things, there's no real one way to do it or one particular strategy that's probably going to be absolutely the most critical. There might be, but given sort of the differences across contexts, I think what's important and what's not can be better articulated at the outset by people who are developing the interventions. It can be better supported when things are actually being implemented by, maybe in the context of training, making it really clear and even providing some degree of a framework surrounding how things may be locally adapted or modified. And then when feasible, having data, especially data about those more proximal outcomes, those sort of mechanisms of an intervention, not the downstream effects on the ultimate behavior or the ultimate kind of outcome, but something that can give you a signal earlier and hopefully cheaper. Can be a good way to do that as well. That does require some data and analysis infrastructure of one sort or another, or at least something that could automate that. So I don't know if there's any one answer. The one other thing I want to say is that when we're talking about fidelity, we're trying to make, in a way, we're working for fidelity, but fidelity can also work for us if we know that we're going to need to adapt something. At the University of Washington Alacrity Center, we sometimes think about fidelity when we're implementing it as a great information source for what ultimately might need to be redesigned in an intervention. It's sort of it's a parallel to the kind of old notion where if you're looking to where to put sidewalks, say on a college or university campus, you look at where the paths are tread. Right, because that's how those are people's workarounds, and those are how people are finding their way through the space. And in a way, you can look at fidelity and what people include or don't and why as a way to find the path through the intervention space.
That's a really neat analogy. Knut, I would like to give you a chance to say, because you were trying to say something earlier. Then we have just a teeny bit of time left.
Very fast then. We did an evaluation of MST, and MST uses a special fidelity measure, which is very neat because they interview the parents, not the therapists. Anyway, we followed those for 6 years. It was close to 70 therapists nested in teams. And when we looked on, and the MST fidelity measure was related to outcomes, but the fidelity increased all the time. And what drive the fidelity and then also the outcome? Yes, it was the teamwork, the collective experience. So when we talk about fidelity, we were talking about fidelity like it is, this is fidelity, either or. But actually, fidelity probably is something which develops. So it depends on when you step in and do the research.
That's true. So I I would like to just end this session by thanking you all for joining us, for participating in discussion with us in the breakout rooms, for the panel, for your thought-provoking statements, whether we specifically discussed them or not, and of course for your comments and reflections during this session. I really enjoyed spending the afternoon with you people. So great to see you. Thank you all for joining us today.
Thank you.
Bye-bye.
Bye. Yeah.
Sorry about that.
Oh, well, I'm really glad you did join us. That was
Okay. Good morning.
I can definitely see how that can happen. I hate it with the time differences. It's just kind of one of them.
Well, I mean, the worst part was I double and triple checked. I had originally had it at that time, and then I went to the conference website to identify exactly the most up-to-date information for when it was, and then I put it into a time zone converter so that there would be less human error, and here I still am. Or there I still
maybe
wasn't.
Because they're talking about both Central European time and London time. I don't know if that might have interference things. But
I was trying to convert between Central European time and anyway.
Yeah, no.
Well, good you came at least.
Yeah.
So how was the discussions in the breakout rooms? Did it kind of work? Did people talk and engage?
Yeah, not everyone talked, but some talk. Sure.
Yeah.
I talked.
Yeah. I mean that makes sense. We do. I did too.
I think it was fun actually. The people were talking. I didn't talk so much. They were giving their views and very good session actually.
Yeah, it was kind of fun because we had two practitioners starting saying something like, "So I don't even get it. So why shouldn't you try to focus on fidelity?" And then they continued talking, and so that was the first. I would like to hear someone offer some kind of justification for that. And then they continued to explaining that they work with researchers, and the researchers says it's really important because otherwise they cannot evaluate it. And then they said that it's really hard because the children that they work with are so different from the ones that the researchers had in their studies. Like, okay. Yeah.
Is the complicating issue here that we consider all interventions to be equally evidence-based? So when we talk about fidelity, we talk about like every intervention is very effective and the scientific support is very strong.
And also that
in reality it isn't.
Because that's one of my comments when you said don't tinker with perfection. So for me, that kind of really pushes the bar for how much work you have had to put into that already, and of course how certain you are. But so then it's not only how certain are you that it's effective, then it's also how certain are you that it's the most effective version. And if you only you've done one version, you tested it, and you tested it even though we've tested it more than one place, how do you know it's the most effective?
And how do you know that you got your fidelity assessment right?
You know you didn't.
Right, because I totally agree that there is a sort of underlying assumption that maybe all interventions are created equal, and that all fidelity evaluation approaches are created equal, which of course we know is not at all the case.
I mean, given the meta-analysis and the interview study that we did, I mean, where people, and that is intervention researchers, they are kind of supposed to have high fidelity in their studies, and they are still very, I mean, they do talk about how they struggle or how they do not even think it's doable, not even in a study context. So yeah.
What do you say? Shall we have 1 minute break before keynote?
Yeah.
Yes, we should.
Thank you very much.
I'm very glad you did
Thank
this.
you.
I
Bye-bye.
enjoyed it a lot.
And thank you, Cassandra, for
Thank you so
supporting
much
us.
for helping us out.
See
I
you
really
tomorrow.
See you
See you
tomorrow.
tomorrow morning.
See
Yeah.
you tomorrow.
Thank you. Bye
Bye bye.
Thanks,
Bye-bye.
everyone.
Bye.